In this video, we will talk about orforglipron. What are the clinical trials showing? When is it expected to be approved? What will this do to the GLP-1 market? So make sure to watch the full video. In recent years, the landscape of obesity and type 2 diabetes treatment has undergone a massive transformation, thanks to the rise of glucagon-like peptide-1, GLP-1, receptor agonists. Drugs such as Ozempic, semaglutide, and Mounjaro, tirzepatide, have become household names, revolutionizing how metabolic disorders are managed. These medications have not only proven effective in improving glycemic control but have also demonstrated significant weight loss benefits, making them a cornerstone in treating obesity and diabetes. However, one major limitation of current GLP-1 therapies is that most require injection, which can be a barrier for many patients. Enter orforglipron, an experimental oral GLP-1 receptor agonist developed by Eli Lilly. Unlike its predecessors, orforglipron offers a non-injectable alternative that could significantly alter the treatment landscape. If approved, it could make GLP-1 therapies more accessible and appealing to a broader range of patients. But what do the clinical trials reveal about its safety and efficacy? How does it compare to existing GLP-1 drugs? When can we expect its approval, and how will it impact the already competitive market for diabetes and obesity treatments? This video delves deep into the science, market dynamics, and future potential of orforglipron, answering these pressing questions. 1. Introduction to orforglipron. Orforglipron represents a groundbreaking advancement in the management of obesity and type 2 diabetes. As an oral, non-peptide glucagon-like peptide-1, GLP-1, receptor agonist, it is designed to emulate the effects of the endogenous GLP-1 hormone, which plays a pivotal role in regulating blood glucose levels and appetite. Traditional GLP-1 receptor agonists have predominantly been injectable formulations, posing challenges related to patient adherence and acceptance. Orforglipron's oral administration offers a more convenient alternative, potentially enhancing compliance and broadening the therapeutic reach to a larger patient population. The development of orforglipron aligns with the increasing demand for effective, user-friendly treatments for chronic conditions such as obesity and type 2 diabetes. By providing an oral option, orforglipron addresses a significant barrier associated with injectable therapies, thereby improving patient experience and treatment outcomes. This innovation underscores Eli Lilly's commitment to advancing diabetes and obesity care through novel therapeutic approaches. Furthermore, orforglipron's non-peptide structure distinguishes it from peptide-based GLP-1 receptor agonists, potentially offering advantages in terms of stability, manufacturing, and storage. These attributes contribute to its potential as a widely accessible treatment option, particularly in regions where cold-chain logistics for injectable therapies pose challenges. In summary, orforglipron embodies a significant step forward in the evolution of GLP-1 receptor agonist therapies, combining efficacy with the convenience of oral administration to better serve patients with obesity and type 2 diabetes. 2. Phase 1 clinical trials. Safety and pharmacokinetics. The Phase 1 clinical trials for orforglipron were meticulously designed to evaluate its safety, tolerability, pharmacokinetics, and pharmacodynamics in healthy participants. Conducted as a double-blind, placebo-controlled study, these trials encompassed both single ascending dose, SAD, and multiple ascending dose, MAD, assessments. Participants received varying doses of orforglipron, ranging from 0.3 mg to 24 mg, to determine the optimal dosing regimen. The results demonstrated that orforglipron was generally well tolerated, with the most common adverse events being mild to moderate gastrointestinal issues such as nausea and diarrhea. These side effects were transient and consistent with those observed with other GLP-1 receptor agonists. Importantly, no serious adverse events were reported, indicating a favorable safety profile for further clinical development. Pharmacokinetic analyses revealed that orforglipron has a half-life ranging from approximately 24.6 to 67.5 hours, supporting the feasibility of once-daily dosing. This extended half-life is advantageous for patient adherence, as it reduces the dosing frequency compared to some existing therapies. Additionally, pharmacodynamic assessments indicated significant reductions in fasting glucose levels and delayed gastric emptying, aligning with the therapeutic goals for type 2 diabetes management. Notably, participants experienced substantial reductions in body weight, with decreases of up to 5.4 kilograms over 4 weeks, compared to a 2.4 kilogram reduction observed with placebo. These findings provided compelling evidence of orforglipron's potential efficacy in weight management, warranting progression to Phase 2 trials. 3. Phase 2 clinical trials. Efficacy in obesity management. Building upon the promising outcomes of Phase 1, the Phase 2 clinical trials focused on evaluating the efficacy and safety of orforglipron in adults with obesity or overweight conditions. This randomized, double-blind, placebo-controlled study involved administering various doses of orforglipron over a 36-week period to assess its impact on body weight and related health parameters. The results were compelling, with participants receiving orforglipron achieving mean weight reductions ranging from 9.4% to 14.7%, depending on the dosage, compared to a 2.3% reduction observed with placebo. These findings indicate a dose-dependent relationship, suggesting that higher doses may confer greater weight loss benefits. Furthermore, a significant proportion of participants achieved clinically meaningful weight reductions, with up to 90% attaining A is greater than or equal to 5% reduction and up to 75% achieving A is greater than or equal to 10% reduction in body weight. Beyond weight loss, orforglipron demonstrated favorable effects on cardiometabolic parameters, including improvements in blood pressure and lipid profiles. These benefits are particularly relevant for individuals with obesity, who are at increased risk for cardiovascular diseases. The safety profile remained consistent with previous findings, with gastrointestinal events being the most common adverse effects, typically occurring early in treatment and diminishing over time. These Phase 2 results underscore orforglipron's potential as an effective oral therapy for obesity management, offering significant weight loss and metabolic improvements with a manageable safety profile. 4. Phase 2 clinical trials. Impact on type 2 diabetes. In parallel with obesity studies, Phase 2 trials also assessed the impact of orforglipron on glycemic control in adults with type 2 diabetes. Participants were administered varying doses of orforglipron, and the outcomes were compared to those receiving placebo and dulaglutide, an existing GLP-1 receptor agonist. The primary endpoint was the change in glycated hemoglobin, A1C, levels at 26 weeks, with secondary endpoints including changes in fasting blood glucose and body weight. At 26 weeks, orforglipron demonstrated significant reductions in A1C levels, with decreases of up to 2.1%, compared to a 0.4% reduction with placebo and a 1.1% reduction with dulaglutide. These results highlight orforglipron's superior efficacy in glycemic control compared to both placebo and an established GLP-1 receptor agonist. Additionally, participants experienced substantial weight reductions, with decreases of 5. Phase 3 clinical trials. Confirming efficacy and safety. Building upon the promising Phase 2 results, the Phase 3 clinical trials for orforglipron are designed to confirm its efficacy and safety across a broader population. These large-scale studies involve thousands of participants and assess the drug's long-term effects on weight loss, glycemic control, and overall metabolic health. The Phase 3 trials aim to evaluate orforglipron's ability to maintain weight loss over an extended period, addressing concerns about sustainability. Researchers will also monitor cardiovascular health markers, such as blood pressure, cholesterol levels, and heart rate, to determine any potential risks or benefits beyond weight management. A crucial aspect of these trials is the direct comparison of orforglipron with existing GLP-1 receptor agonists, including semaglutide and tirzepatide. By assessing its effectiveness relative to these established drugs, the trials will help position orforglipron within the competitive obesity and diabetes treatment landscape. Safety remains a top priority, with close monitoring for adverse effects such as gastrointestinal discomfort, pancreatitis, or rare but serious complications. The findings from Phase 3 trials will be instrumental in determining whether orforglipron receives regulatory approval and how it will be recommended for clinical use. 6. Expected FDA approval timeline. Given the positive momentum from early clinical trials, orforglipron is on track for potential approval in the coming years. Eli Lilly has indicated plans to submit regulatory filings based on Phase 3 results, with the U.S. Food and Drug Administration, FDA, expected to review the drug in the near future. The typical approval process involves a thorough examination of clinical trial data to assess the drug's safety, efficacy, and overall benefit-risk profile. If Phase 3 trials yield favorable results, Eli Lilly could file a new drug application, NDA, with the FDA, which generally takes 6 to 12 months for review. Additionally, orforglipron may qualify for priority review if it demonstrates significant advantages over existing treatments, potentially expediting the approval process. Regulatory agencies in Europe and other regions may follow a similar timeline, allowing for global market entry. While unforeseen delays due to regulatory scrutiny or additional trial requirements are possible, current projections suggest orforglipron could receive FDA approval by 2025 or 2026, making it one of the first oral GLP-1 receptor agonists to enter the market. 7. How orforglipron stands out in the GLP-1 market. The GLP-1 receptor agonist market has been dominated by injectable therapies such as semaglutide, Ozempic, Wegovy, and tirzepatide, Mounjaro. Orforglipron's oral formulation provides a distinct advantage, potentially increasing accessibility and adherence among patients who prefer pill-based treatments. Unlike peptide-based GLP-1 receptor agonists, orforglipron's non-peptide structure offers potential benefits in terms of stability, manufacturing, and distribution. This could make it more cost-effective and widely available, particularly in areas where cold storage for injectable drugs is challenging. Moreover, early clinical data suggests orforglipron may offer weight loss and glycemic control results comparable to, or even exceeding, existing GLP-1 drugs. If these findings hold up in Phase 3 trials, it could become a first-line treatment option for both obesity and type 2 diabetes. As the demand for GLP-1 therapies grows, especially with increasing interest in weight management solutions, orforglipron's oral delivery method may drive market expansion and redefine patient preferences in the obesity and diabetes treatment space. 8. Potential impact on competing GLP-1 drugs. The introduction of orforglipron could disrupt the GLP-1 market by challenging the dominance of injectable treatments. Pharmaceutical giants such as Novo Nordisk, which manufactures Ozempic and Wegovy, may face increased competition, particularly if orforglipron proves to be equally or more effective. A shift towards oral GLP-1 therapies could lead to pricing adjustments, as companies may need to lower costs to remain competitive. This could benefit consumers, making GLP-1 medications more affordable and accessible. Additionally, orforglipron's success may spur further innovation in oral GLP-1 drug development. Other pharmaceutical companies could accelerate research into similar non-injectable treatments, broadening the range of available options. Ultimately, orforglipron has the potential to reshape the landscape of GLP-1 therapies, pushing the industry towards more convenient and patient-friendly treatment solutions. 9. Market forecast. Sales and adoption trends. Industry analysts predict that orforglipron could generate significant revenue if approved, potentially reaching billions in annual sales. The growing demand for weight loss and diabetes medications suggests a strong market uptake, particularly among patients who have been hesitant to use injectable therapies. The success of existing GLP-1 drugs, such as Wegovy and Mounjaro, highlights the high level of interest in effective weight management treatments. If orforglipron demonstrates superior or comparable efficacy, it could capture a substantial share of this market. Insurance coverage and pricing strategies will play a crucial role in adoption. If Eli Lilly positions orforglipron competitively, ensuring broad insurance reimbursement, it could become a preferred option for both patients and healthcare providers. Furthermore, long-term data on safety and cardiovascular benefits could enhance its market appeal, driving sustained growth and reinforcing its position as a leading oral GLP-1 therapy. 10. Conclusion. The future of oral GLP-1 therapies. Orforglipron represents a major advancement in obesity and type 2 diabetes treatment, offering a convenient oral alternative to injectable GLP-1 receptor agonists. With promising clinical trial results, a strong safety profile, and a potentially favorable market position, it is poised to make a significant impact upon approval. The anticipated FDA review in 2025-2026 could mark the beginning of a new era in metabolic health management, where oral GLP-1 therapies become mainstream. This shift could enhance treatment adherence, expand patient access, and drive further innovation in drug development. As pharmaceutical companies continue to explore new formulations and combinations, orforglipron's success may pave the way for additional oral therapies with even greater efficacy and tolerability. In summary, orforglipron is set to be a game-changer in the GLP-1 market, offering hope for millions of patients seeking effective, user-friendly solutions for weight loss and diabetes control. Orforglipron is set to revolutionize the GLP-1 market, offering an oral alternative to injectable weight loss and diabetes treatments. With promising clinical trial results, it could improve accessibility, patient adherence, and affordability. If approved, it may challenge existing drugs like Ozempic and Mounjaro, reshaping the competitive landscape. The demand for effective obesity and diabetes solutions is growing, and orforglipron could be a game-changer. Its anticipated approval in 2025-2026 signals a shift toward convenient, non-injectable therapies. As research continues, orforglipron's success may drive further innovation, making advanced metabolic treatments more widely available to patients worldwide. What do you think of our video? Let me know in the comments section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go. Thank you for watching.